We also have a couple of polls throughout the event, and we will go through and show the results. So go ahead and please answer those at any time. And today we will be discussing the sun protection, skin cancer detection and prevention, skincare treatments, and skin cancer. Without further ado, I would like to introduce our two speakers today. We have Maria Poole, our skincare specialist, and our board certified dermatologist, Dr. Julia Kwan. And would you please tell us a little bit about yourself, doctor?
Thank you. Well, I was born and raised in Southern California. I went to UCLA undergrad, and then I actually ended up going to the East Coast to New York to study medicine, and actually had a Navy scholarship, so they paid for that. And when I finished my medical training, I went to do a transitional internship at Naval Medical Center San Diego. I actually ended up going on a ship right after that and being the general medical officer on an amphibious warship called the USS New Orleans. And we did sail through the Panama Canal, and we had some fun, but not exactly that much fun. Mostly it was a new ship, so it required a lot of work. After doing that, I went on to complete my dermatology residency at Naval Medical Center San Diego, after which time I was stationed in Pearl Harbor for 4 years. And so I actually was in for about 11 years before getting out and coming back to Southern California. I like medical dermatology the most. I feel that's, where I can help people the most. And so I go to 2 locations, one in San Pedro, one in Torrance Sky Park. Next slide, please. So we're going to talk about sun protection, skin cancer detection and prevention, as well as skin cancer treatments. And then later we'll have another expert that will talk about sunscreen in particular. Next slide. So we want to practice the 3 Ps. That includes protecting our skin, preventing, things from happening like skin cancer, aging, things that we don't like, and persevering, or basically not stopping doing those things just because we think we're okay. Okay, next slide. So the first is sun protection. So the first P. So, everyone says, check the UV index on the days to see when we have the highest index. But honestly, in Southern California, that's really pretty much all the time, just given where we are in our location. So we really don't want to rely on the feeling that just because it's a low UV index that we don't have to protect our skin. We should always be protecting our skin no matter what, because UV damage is cumulative and there's really no daily allotment that we're allowed to have. It only gets added to what I call like a bucket of sun exposure, and it happens over a lifetime. So we have to consider every little bit of exposure we get, because that does increase our risk of skin cancer. And it literally does take decades to see those changes, to see those cancers develop, to see the signs of premature aging. I think that, we shouldn't rely on one thing to protect ourselves. We have to rely on many layers of sun protection. So the best thing I think is actually to cover up if you can, stay in the shade, wear UV rated clothing, broad brim hats, sunglasses. Clouds are very deceptive because you think you're, not getting as much exposure, but UV light is actually invisible, so you can't see it, and it actually penetrates right through clouds. And you actually get a lot more exposure because you think you're not being exposed, but you are. The next step is obviously wear your sunscreen every single day. There's some debate about like which is the best kind of sunscreen. I like mineral sunscreen better, but I don't think there's anything necessarily wrong with chemical sunscreen. Really, if there's a sunscreen that you like, that's the best sunscreen, because if you don't wear it, it's not going to help you. And in terms of chemical sunscreen, I know that there's a concern about, having too much penetration to your skin, causing any kind of systemic absorption, but you really actually have to put quite a bit on, like multiple times a day, in a way that nobody would actually do to have any kind of effects, in terms of systemic absorption. It's great to have an SPF. I like 50 plus. I know everyone says 30, but nobody puts it on quite the way that, it's tested in the lab, which is very tricky. SPF 30 would be fine if you actually put on one shot glass full to your entire body, which is about quarter size in your face. It doesn't sound like a lot, but it's actually a lot once you start applying it. And so let's go to the next slide. Okay, so the next P is prevention. We want to do things to prevent or reduce our chances of getting skin cancer. To do that, we should get our skin checked. Now, everyone asks, how often should I do that? Well, it depends on your risk factors. If you're very fair skin, you're in the sun a lot, you might want to come every year. If you had skin cancer, you should definitely come at least once a year. If you don't have a lot of, exposures, it's not to say that you shouldn't come, but you could probably reduce it to every few years. And if there is something that develops that you're really worried about, obviously you would want to come in sooner. So whether you burn easily or tan well, there's always a risk of skin cancer, even if, you don't think you're getting a lot. Everyone always says, I don't go in the sun, but, everyone walks to their car, everyone goes to the grocery store, everyone gets their mail. Those are all times that we're getting exposure. And so we have to consider that, again, it's all cumulative damage, and it takes 30, 40, 50, 60 years sometimes to see those happen. We generally look for the ABCDs of melanoma. Although melanoma is only the third most common type of skin cancer, it's also the one that can be the most deadly. A stands for asymmetry. So when we cut something in half, we want one side to look like the other. The borders of a spot should be nice and smooth. The color should be uniform, although that comes with a caveat, as some people don't make completely uniform moles. But the key really is that all their moles have that same look to them. Diameter, we do pay attention more when something reaches about 6 millimeters, which is about a pencil eraser size, but that's not as much what I focus on as because there are things that I've seen that are very small, very dark, very symmetrical, and it's melanoma or something akin to it. And so I really rely on E, or evolution change. If something is changing in a way that deviates from how your normal moles look like, that is something that should get checked out. It doesn't matter if it's symmetrical. It doesn't matter, if the borders are round. It doesn't matter if it's tiny. It could just be that jet black mole on your skin when you don't make that color normally on your skin. And of course, if you don't go in for regular skin checks, it doesn't absolve anyone from at least looking at their skin when they're in the shower every so often, looking for something that looks kind of suspicious, getting, your partner to look, if it's an area that's hard to see. Next slide. So persevere, that's a third P. So we don't want to stop protecting our skin. Once we start, we cannot stop. Skin cancer doesn't take a break. It doesn't take holidays. There's no allotment, again, that we can have that is okay. There's a lot of old thinking and new thinking, and we used to think that a tan was glamorous, attractive, but in actuality, a tan is a sign that your skin has been injured. Just because you tan well doesn't mean you're not damaging it. In fact, you have to damage your skin in order to tan it. And people used to think, oh, sunscreen is that zinc white stuff that goes on your nose and looks, really thick. Well, these days, sunscreens are super elegant. They're formulated to be sheer, almost invisible looking. And so there's a lot of formulations that, you can try. Not everything will fit for everybody, but you can try different ones, and there's always going to be something that you can use. Thirdly, we used to think that, the perfect beach wear was just to basically wear a bikini and a baseball cap. But, nobody says that you can't have fun at the beach, with your clothes on. So I always recommend, wearing UV clothing, long sleeves, long leggings. There's a lot of stylish brands out there, and you can look very fashionable with your broad brim hat and UV clothing and still have a lot of fun. Okay, next slide. So most people aren't aware that skin cancer is the most common of all cancer types. So the likelihood that you're going to get a cancer, the most likely one is skin cancer. Even all the next 4 common cancers combined don't even come close to the number of skin cancers that are diagnosed, every day and every year. So no matter what your skin type is, there's always going to be a risk that, you're going to get skin cancer because, again, it's the most common of all cancers. Next slide. So let's talk about some of the actual mechanism of how do we get skin cancer. So ultraviolet light is a carcinogen. It basically damages your skin in a way that causes changes that lead to abnormal cell division. When your cells are dividing abnormally, you can get a spectrum of change. When it gets to the point where the skin is dividing uncontrollably, just like any other cancer, it becomes a skin cancer. So there are actually two main types of UV light that actually hit the Earth's surface. There's UVA and UVB. I like to call UVA the aging rays because it's easy to remember, A for aging, because it penetrates deeper into the skin. It gets to your collagen. It goes down deep towards the fat. It's why that causes more wrinkles, because it damages the collagen elastin that's normally supporting your skin. It's the stuff that props your skin up. So since it goes deeper, it can cause both skin cancer as well as your wrinkles. UVB is the second type that gets to the Earth's surface. It's the one that actually is more in a bell curve. It kind of is lower earlier in the day, later in the evening, and it kind of peaks at a level midday. And that one only penetrates up to the top layer of the skin, the epidermis, and it's responsible for the majority of skin cancers. It causes your skin to tan, but it also causes skin cancer. Again, UVB is the one that SPF is really focused on. UVA isn't accounted for in SPF. That's why it's important to get a broad spectrum sunscreen, because the SPF rating has nothing to do with UVA. UVA is also present all day long at the same low level, no matter what time of day it is, as long as the sun is up. So that's why it literally takes decades, because it's very, very low level, decades to see those kind of wrinkles, the premature aging. It really takes like 3 or 4 decades to start to see that. We know that UV light can be natural, artificial. There are tanning beds that are out there that people will go to. And unfortunately, those tanning beds have a far more UVA than just natural sunlight. And that's why if you go to a tanning bed, you're much higher risk for skin cancer, because there's 12 times more UVA in those beds, which is going to accelerate aging, plus the risk of, getting melanoma, basal cell, or squamous cell. Next slide. So, as I said, there's a spectrum of damage that can happen. We have more commonly these precancerous lesions called actinic keratoses. Those are skin cells that have been damaged by UV exposure and are dividing abnormally, but not to the point where they're out of control. And, actinic keratoses are usually like rough, scaly spots that people are like, well, why is this not going away? It's just staying here. I moisturize it very well, but it's just there. And so as they grow, they can become thicker, more horn-like, and then eventually progress into a skin cancer if we're not careful. So we do try to treat these when we see them. If they're just a few spots, we can use liquid nitrogen, which is basically giving it frostbite, and you spray it, it feels really hot and kind of cold at the same time, and then it scabs, and then the whole goal is to peel it off. If there are too many spots, and we can't spray the whole face with liquid nitrogen, there are creams that we can use, and there's many different out there right now, ones that range from 3 days to 6 weeks of treatment. But again, everyone's a little different in how they respond. So those can be done. They're not pretty, but they definitely work. Now, what happens if you actually get a skin cancer? Well, fortunately, the majority of skin cancers are not going to kill you, because the most common type would be basal cell and squamous cell, which are fairly localized unless, they're larger, have been left, there for many years. Most of those can be simply cut out. The only caveat that we come up with, in terms of problems and complications is location. So sometimes, a lot of times, these skin cancers are in cosmetically sensitive areas, or areas that don't have a lot of extra skin to kind of compensate once you cut it out. And so there's a technique we'll be talking about later called Mohs, which is a specialized kind of surgery that's done by special dermatologic surgeons that gives you a higher cure rate and takes less tissue. You may ask, why don't we do that for everything? Well, of Of course, cost is a huge, issue. Insurance companies don't want to pay for things that aren't 100% necessary. If it was on your back, your chest, an area that had a lot of extra skin, there's no problem cutting out your standard margin. But if it's on your face, scalp, your nose, maybe like a shin or something, those are harder areas they're easy to cut out. They're just hard to kind of close back up. And so that's where this technique really shines. Next slide. Okay, so what happens, if you have to have Mohs surgery? Well, this is just a visual kind of diagram of what would happen. So you have a spot, and normally, if you had a basal cell or squamous cell on your back or your chest, there's plenty of skin to kind of compensate. So, you measure around 4 millimeters all the way around, then you cut like a football shape or size out. Well, not size, but shape out. And it ends up being, about 3 times the original size of what you cut out. Now, you don't want to do that on the face or the scalp because there's really not a lot of skin to kind of close it back up. It's very tight. So this technique allows you to kind of take a section like you're seeing in that first number 1, the first thin layer is removed. And then actually while you're, waiting, they actually make a slide, which is processed differently. It's called a frozen section. And they can look, the Mohs surgeon looks under the microscope and says, oh, it looks like it's clear, or no, maybe there's a little bit at like a 12 o'clock position or a 6 o'clock position. And then they go back and they're like, okay, we're just going to take it from this side that I see it positive. And then they look under the microscope again. And if it's clear, they close it up. If it's not clear, they keep going until they finally clear the margins. And that is a way of kind of guaranteeing that you have a more clearance before you close it without taking a huge chunk of skin. In a regular excision, that piece that you take out is sent to a regular lab, processed in a regular way, and it's kind of sections, not like a pie like you're seeing in the diagram, but more like we call a bread loaf, where sections are taken and those sections are examined for clearance. It doesn't give you as much of a guarantee that it's gone, but if you're taking a wider margin, it really doesn't matter because most likely you have gotten it. And this is just kind of a summary of what we just talked about. Mohs surgery, the highest cure rate for skin cancer. But again, it's only done for really hard to close areas or cosmetically sensitive locations, mostly because of cost. It's all, I forgot to mention, it's all done under local anesthesia, which is one of the benefits. You don't have to go to an OR. You will be awake. You'll be able to respond. And you can go home with very little, care other than just taking care of your wound when it's complete, and then you come back for your suture removal and it's checked on, and you come back for your skin checks as regular, and it's pretty routine. Next slide. I think that was it, actually.
Thank you, Dr.
So yeah, that's all I have.
That's great. That was incredibly interesting. So I'm going to speak a little bit about products that we can use to help support protecting ourselves against potential skin cancers. We have a pop-up poll. I encourage you to fill out this multiple choice questionnaire, and we'll address it early or later on in the presentation. Next slide. So in fact, sunscreens have come a long way, and they really are your first line of defense to protect against skin cancers. Sunscreens are no longer that white heavy paste that we used to see in the Gidget movies. They are really cosmetically elegant. And furthermore, sunscreens now are multitasking. So we're seeing sunscreens doing so much more for addressing the skin health and beauty than we have in the past. So I see that people use 50-50 chemical and mineral. And as Dr. Kwan said, the sunscreen that you use is the best sunscreen for you because it doesn't work if you don't apply it. So either mineral or chemical is ideal as long as you're using it every day. I also see that we're using body sunscreen, and that's phenomenal. We do want to look at a variety of different sunscreens in our arsenal. For the face, maybe a clearer tinted, for the body, a reapplication method, whatever we can do that is easy and simple to continue the application, and that it's cosmetically elegant, that we want to use it every day. Next slide. So the first sunscreen I'm going to speak to is the Physical Tinted BB Cream Sunscreen SPF 30. I adore this sunscreen. It is an all mineral sunscreen made up of both zinc and titanium. I talked about multifunctioning sunscreens. This truly is the epitome of a multifunctioning sunscreen. I call it my one and done or my 6-in-1 sunscreen. It does have excellent protection with a mineral sunscreen. It is lightly hydrating, all day oil control, packed with antioxidants, which provide that second line of defense. It is tinted. So this tint is working with your own natural skin tone. You might put this on initially and say, oh, this is absolutely wrong for me. But as it melts into the skin, it reflects your natural skin tone and diffuses those imperfections. And it makes an amazing primer if you choose to wear foundation on top of it. This is great for all skin types, and it can be used or should be used during the summer, obviously, but during the winter as well, when we're not seeing as much sun exposure. Next slide. The Sheer Sunscreen Lotion, again, an all mineral sunscreen, multitasking, and this is really ideal for all skin types. And I find that men are more apt to use this as well because of its clear nature. So it is a clear zinc. And again, we have that second line of defense of antioxidants that are neutralizing the UV-induced free radicals. It is lightly hydrating, and we have vitamin C in it, which is a very powerful antioxidant and brightener for the skin. And as much as these ingredients are important to the sunscreen, what we don't put in our sunscreens are equally as important. These sunscreens are oil-free, alcohol-free, fragrance-free, paraben-free, gluten-free, chemical-free, non-comedogenic, and non-whitening. Next slide. So we've spoken about the benefits of using a sunscreen every day, and that there's a sunscreen for everybody that you are excited to reapply and use daily. However, there are additional products that really do support the benefits of the sunscreen, protecting against skin cancer, free radical damage, and how to get that sunscreen off. So again, we have another poll, washing sunscreen. Do you properly wash your sunscreen off every night? So I'm going to ask you to answer the poll, and we'll go to the next slide. So when we apply sunscreen, and most particular, the mineral sunscreens tend to be water resistant, which is great, but they're a little more challenging to get off the skin. So we encourage you to use a good cleanser that is pH balanced, and pair that with some kind of mechanical cleansing device, whether it be a terry cloth towel or one of the rotating brushes that help pull the sebum, debris, the dirt, the sunscreen off the skin. This particular cleanser is one of my favorites. It is just as clean as they come. It is a gel cleanser. It's fragrance-free, dye-free. It's a very simple cleanser, but it contains papaya enzymes. Papaya enzymes will digest the dead proteins on the skin and really do help encourage cleaner skin. We have additional antioxidants as well to calm the skin. And this was actually developed for post-procedure. So it's ideal for all skin types, even the most sensitive and reactive skin. Next slide. Okay, I'm going to get on my soapbox at this point because I truly believe this is one of the most important products that you can add to your skincare regimen. So as we apply our sunscreens, we're doing a beautiful job protecting against that UV exposure, but there is the potential that we get oxidative stress and free radical damage when exposed to the sun, or just pollution, or what we're doing in our daily lives. This particular product, I believe, is the most powerful antioxidant available on the market. It is a combination of 3 antioxidants: green tea polyphenols, caffeine, and resveratrol. Green tea polyphenols and the 80 to 90% purity, this product is the 90% purity, have been shown in published clinical studies to shut down precancerous cells, reduce topical tumors, that they are the broadest spectrum and fastest acting antioxidant available. And although I'm not saying this is going to cure cancer, prophylactically, I think it is a perfect addition under your sunscreen to protect your skin. The second ingredient, caffeine, helps reduce the pore size, also works in combination with the green tea polyphenols to address something called selective apoptosis. It releases an enzyme into your damaged cells and removes them. So we're not splitting those damaged cells. And then the last ingredient is resveratrol, very powerful antioxidant, which is antibacterial, anti-inflammatory, and together this truly is the powerhouse antioxidant. Next slide. Okay, so we want to talk a little bit about, and I know that Dr. Kwan touched upon this, the difference between UVA versus UVB as your sun protection. So UVA is really talking about those aging rays, rays that are going deeper into the skin and damaging the elastin and the collagen. And the UVB is the burning rays. Those are the shorter rays that are really addressing the concerns of skin cancer. But did you know that the SPF rating on your sunscreen, it's not linear. So when we look at an SPF 2, it blocks 50% of those UV rays. And when we jump it up to an SPF 30, it's blocking 97% of the rays. You would imagine that if we go to 2 to 30, it's going to be dramatically more. But really, SPF 30 is the minimum that you should be using to protect against those burning and aging rays. And then SPF 50 is a higher block, and it blocks about 97 to 98% of those UVB rays. And again, when we look at an SPF rating, that rating is specifically speaking to the burning rays. It is not speaking to the aging rays. So having a secondary line of defense with antioxidants in your sunscreen really is essential at helping protect against those aging rays. Next slide. Once again, we are looking at the critical wavelength, the UVA and the UVB broad spectrum protection. And I think the biggest call out here is when we look to the burning rays, that's the shorter rays. That's what we're seeing up front. So we're seeing a lot of protection over the burning rays, but a lot of sunscreens don't do a great job protecting the aging rays. You really want to look for a mineral sunscreen to provide better protection over those UVA rays. Next. All right. So we talked a little bit about sunscreens and how to protect yourself against skin cancer. But it happens, right? As Dr. Kwan said, this is cumulative. So the damage that we did earlier in our lives may show up as we age. So in the event that you have had some form of skin cancer and melanoma and have had to do Mohs surgery or some form of surgery, we want to talk about how we can heal those wounds properly. So the next step in the slide is the scar recovery gel. This gel can be used immediately after the in-office procedure. And what this gel is doing is creating a breathable protective shield over the wound so that we can have healthy healing and scarring. It takes a full year for a wound to heal. So we want to protect it and give it a proper environment so that we can support skin renewal and healing. This is a unique medical grade silicone. And in addition to providing this nice barrier to the skin to encourage healing, it has proteolytic enzymes in it that help prevent those hypertrophic or atrophic scars, those scars that are uneven, not flat. And it provides optimal hydration as well as antioxidants to help prevent the inflammation or the runaway inflammation, which helps delay the healing process. So ideal for post-surgery, post-Mohs, but the truth is wounds are inevitable. So having this in your medicine cabinet is a great solution for preventing any visible scarring. Next. And a companion product to the Scar Gel is the Scar Care SPF 45. It is a very similar formulation to the Scar Gel, but this includes a micronized zinc, and it protects SPF 45 and protects against the UVA and the UVB rays. Here's the deal. Sun is the enemy to scarring. As Dr. Kwan spoke earlier very eloquently, that those UVA rays, those deeper rays, and they're going to the collagen and elastin. We need that collagen production to help with the wound repair and healing. If the sun rays are affecting the collagen, we're not going to get optimal healing. So having a sunscreen in your wound repair regimen is essential to protecting against malformed scars, slower healing rate, or even pigmentation of the scars. Next slide. All right, that is it for me. We're going to give this back to Nika and let her answer any questions and tell you what kind of promotions we're running.
Thank you, Maria. Thank you, Dr. Kwan. So if you guys have any questions, please go ahead and submit them in the chat. We do have a couple of specials going on. If you scan those QR codes in the corner, it'll take you to our website. We have 25% off either our sunscreen trio or our scar care for the next 48 hours. There's a code UV safe that you guys can use. We also will honor it in our offices as well. So just be sure to ask them. Products are in select location. This will be uploaded on our YouTube channel. So if you guys would like to rewatch this, it should be up in the next couple of days. And on our website as well, we also have blog posts about different questions and topics if you guys would like to check that out as well. So a couple of questions that I did get in was how often to apply sunscreen, even if I'm inside, and how much to use for the face and body.
Well, you actually need to put a quarter size in your hand and then put that on your face. But I usually tell people, put that in your hand and then kind of distribute it equally across like the four corners of your face plus your nose, and then spread it evenly. Don't put too much on one spot because it really is going to be hard to rub in otherwise. But that's actually how much you need according to the 1 ounce shot glass full, like to the entire body way that the sunscreens are tested. For reapplication, I mean, if you're not going outside, you're not really sweating it off. I mean, the likelihood is you probably don't need to reapply until you do go outside. That's what I would do.
What about the proper order of skincare in the morning?
Sunscreen always goes on last. That's what I do.
So cleanse, antioxidant, moisturizer, sunscreen.
What about on the Scar Gel and the Scar SPF? Does it have to be on new wounds, or what's the soonest time that you can use it on an old wound as well?
So it takes a full year for a wound to heal. If the wound is closed, then I would go straight to the sunscreen and continue using that. I will tell you that I use that sunscreen, even though it's indicated for scarring, I use it every day. It is one of the most cosmetically beautiful sunscreens I've ever used, and all of my foundation and makeup goes on perfectly over it. So I would continue protecting that wound with sunscreen moving forward once the wound has reepithelialized. Does that make sense?
Yes. What about the BB cream? Can men use that sunscreen?
I have a lot of male ones that actually love this sunscreen because it does even out those imperfections and provides a beautiful glow to the skin. Cosmetically, it's wildly elegant. So yeah, absolutely. And it is really a light tint and it is color matching. So it does not look like you have makeup on.
Awesome. What about fragrances? Are there fragrances in these products if I have sensitivities or allergies to them?
I can speak to the sheer mineral sunscreen and tinted that we spoke to, as well as the scar treatment. There are no additional fragrances added. We know that the patients coming into California Skin Institute are either coming in with skin concerns, or maybe they've done a cosmetic treatment and they're leaving with skin, sensitive skin or sensitized skin. We will not put anything into our products that we believe could create some form of further response or reaction.
Are these sunscreens environmentally friendly and for the water?
I love that. Good question. Yeah. So all of the sunscreens that we've discussed today are all mineral. It is the chemical sunscreens that have been flagged as concerns for the coral reef and the water. So these are all mineral. They are perfectly safe. So bring these on your summer vacations.
How can you tell the difference between a chemical sunscreen and a mineral sunscreen?
Yeah. So the back label, right? So flip it over. The back label, a mineral sunscreen is going to be zinc or titanium. Anything that is not that is chemical in nature, and it usually has a long, complicated name.
What about, since we're on the subject of sunscreen, can you use these for the pool? Is it better to use a stick, a spray, a lotion? And what about for the head?
Yeah. Dr. Kwan, I think you'll agree that the sunscreen you wear is the best sunscreen to use.
That's true. Yes.
Yeah.
I mean, I don't really like sticks as much because it's hard to say whether you can see it on your skin. If you spray, you should spray on your hand and wipe it. You know, you don't know how much is getting aerosolized. So really spray on your hand, wipe. I prefer the lotions because I know it's on. I can feel it, you know.
And look for something that's water resistant. If you're going to the pool or you're living an active lifestyle, maybe cycling, we're going to sweat. So using something that has some water resistance is going to ensure that we're having some long lasting effect, that it's not just coming off in the water, and reapplication. And for the scalp, I find that the powder sunscreens are quite easy to apply to the scalp. Certainly easier, especially if there is some hair, than a cream or even a spray. But
Dr. Kwan, you meant, sorry.
I'm a cat.
Well, on top of the hat, Dr. Kwan, you had mentioned about wearing sunscreen protection clothing at the beach, but is this something that people can utilize on their day-to-day behalf? What about hats that have UV protection? What are your thoughts?
I wear UV clothing every single day. Under this white coat is a UV shirt. So, I mean, I love my UV clothing because, you know, not everyone's going to remember to put sunscreen on. Sunscreen is not foolproof. You can tan through it. You're getting something. So, again, I like to have layers. I put sunscreen on my face, my neck, my ears, but I have UV gloves. I have UV shirts. I don't have UV pants, but I think most of my pants, because material actually matters when it comes to UV protection. Your average t-shirt maybe has an SPF of like 8 or 10, but you know, cotton and loosely woven clothing has less protection. Polyester synthetic stuff with tighter weaves usually have high protection. Jeans are very protective because they're very thick, they're very tightly woven, unless they have holes in them, you know, purposely, will protect you very well. But there's a lot of elegant stuff out there. There's stuff made for like people who are very athletic, you know, there's clothing just made for everyday wear. It looks like regular shirts, but the only difference is these materials have been tested to say, yes, this is how much is actually going through this material, and this is how much UV you can see going through it. I mean, nothing lasts forever, but generally speaking, this clothing is, you know, fairly long lasting. I actually use a UV jacket to put on regular clothing sometimes. And, you know, I make sure to protect my neck because neck is an area that women show their age. So you can take the jacket off when you go in. It's a nice protective thing. And actually my jackets are actually, they're actually water jackets. They're for swimming, but I don't swim, but I use them and they just look like literally like you cannot tell. I mean, they're really just like jackets. And I have many different colors of them and I have many different hats. And I love my UV gloves because another area that women show their age is the top of their hands. And it's very, there's a lot of stuff you can do on your face. You can resurface, you can do stuff, but it's really hard to, you know, work on the neck. It's hard to work on your chest. It's hard to work on your hands. So those are areas that I really focus on covering up, not just using sunscreen alone, especially on the hands. You know, sunscreen's going to come right off because if you're like most people, you're going to use the restroom, you're going to wash your hands, you're going to put hand sanitizer on. It's going to take everything off. So, you know, certain areas I just rely more on just like physical protection.
You mentioned gloves. Would that be something to help protect? You know, a lot of people are driving in their car, different versions
Absolutely.
of protecting in the car.
Yeah, I mean, not only protect your hands from, you know, exposure, but protect your car from all the sunscreen that will get on it everywhere. So I love my UV gloves. I even just go outside, just walking, you know, to my car, going to the grocery store. I just take them off when I go inside, and it's a very easy way of not staining everything yet protecting your hands. And the hands get a lot of damage. You know, you don't think about it, but I've definitely seen a lot of people who have skin cancer of their hand or their finger, and it's not pretty. You know, it's another area that's, again, you can cut it out, but it's very hard to, you know, close it back up. You know, cutting out is easy, closing it up is the hard part. That's where the challenge always comes in. So yes, I love my UV gloves. I even have UV film on my car windows and home windows because if you ever look at your drapes or anything close to the window, I mean, it bleaches you know, your drapes, your carpet. I had, you know, hardwood floors installed in a place I lived in. He's like, "Oh yeah, just wait later. You'll get some blonde streaks in your redwood flooring." I'm like, "Oh, that's interesting. I just never thought about it." You know, it's like the same reason that you can get blonde streaks in your hair when you go to the beach a lot because the sun is basically bleaching everything. You put a piece of paper out there, it will become like tissue within a few days. You know, it just destroys stuff. So.
This is an interesting question. My doctor said research shows many sunscreens from Europe are more effective and FDA hasn't approved them yet, even though dermatologists have asked in 2019, should people try to get some from Europe?
Those are all chemical sunscreens, just let you know. Those are not mineral sunscreens. To speak to the efficacy, I don't know. I'm not saying they're not bad. They're not like bad things, but you know, if we're trying to protect the coral reef and everything, we try to stay more away from those chemical sunscreens. But I don't know that they're necessarily more effective than, you know, zinc and titanium. Zinc actually has one of the largest, you know, coverage spectrums, UVA and UVB. Only avobenzone probably matches that. That's a chemical sunscreen. I think the one that they're talking about, I can't remember, it starts with an E or something. That's the one in Europe that hasn't been approved for here. I don't know if you know anything about it, Maria.
I don't know much about that. And I know that the standards for the FDA and the standards for Europe are quite different. And I don't, because it's approved in Europe, I'm curious if it actually is able to go through our FDA monograph.
I don't know if it's going to. I mean, I think I heard about this sunscreen when I was a resident. That was like 10 years ago. So I don't think we should be focusing so much on that because we have options and a lot of them are good, especially, you know, the mineral sunscreens. I mean, you don't need that chemical sunscreen in the mineral sunscreen if you're using zinc. It has the broadest spectrum of all of the ingredients I've seen. That's why I like zinc.
Yeah. And with the antioxidants backing up the sunscreen, we have that second line of defense.
Does sunscreen affect the natural production of vitamin D?
You know, you don't need, okay, so first of all, vitamin D can be gotten in many different sources. You know, the skin makes vitamin D through sun exposure, but you don't need a lot of that. It's literally like a few minutes. And some people are not great producers of vitamin D through their skin. It just, no matter how much they get, they're just deficient. You know, there are people at the equator who are completely deficient, and you would think, you know, that they would have plenty. I myself, you know, I don't like the sun, so I was deficient. I took like a supplement just from like the regular drugstore, and I'm totally normal. So, you know, don't rely on the sun to give you, you know, vitamin D. Yes, you're going to get, if you have sunscreen on, yes, you're going to get less vitamin D production through your skin, but not in a quantity that's, I think, going to be significant, because again, you only need a few minutes. It's just like basically getting your mail and walking your car. I mean, I don't even want that. I know I'm getting some exposure even with all of my efforts, but again, I really rely on my supplement because it's a more guaranteed way I'm getting it, you know, and I've been tested, so I know, and I'm probably the most sun phobic, you know, dermatologist you're going to meet. So if I'm fine, you'll be fine.
Mhm.
Well, thank you ladies for your time. This has been extremely helpful. Again, you guys, this will be uploaded onto our YouTube. And if you guys have any other questions, please feel free to reach out to us on our website. We have an info page for you guys to ask questions or also book appointments. I want to thank you for your guys' time and have a great day.
Thank you.
Thank you.